anything yet?
Not yet. Are you okay?
It's not feeling too well.
Nina? Nina?
Time to take my pills. Damn, that's the last one.
Nina Perkins?
Yes?
I'll see you now. Hi Nina, nice to see you again. How's everything going?
Hi doctor, everything is going really well, thanks. So I've been taking my anticoagulants, but I'm on my last dose of warfarin, so I need a new prescription.
Oh, I see. In that case, you might be interested in trying out a new drug that was recently introduced, referred to as a new oral anticoagulant or NOAC.
Yes, I've heard of NOACs before, but since they are a new drug, I'm a little uncertain about them. Would you recommend NOACs over warfarin?
I would actually highly recommend NOACs over warfarin as an anticoagulant medication. I remember you telling me that you were a final year medical science student, so I could show you a presentation detailing the effects of the drugs and the pros and cons that come with it, if you would like.
Yeah, that would be great.
Okay, sure. Here you go.
Here is a presentation on new oral anticoagulants. There are known as new oral anticoagulants, and there are 3 types of NOACs approved by the TGA. 1 is apixaban, 2 dabigatran, 3 rivaroxaban. They are usually prescribed to patients that struggle to control their INR levels. The mechanism of action for NOACs versus warfarin. Rivaroxaban and apixaban are competitive reversible antagonists of factor 10 and 10A. Factor 10 and 10A are responsible for the conversion of prothrombin to thrombin, whereas dabigatran is competitive reversible non-peptide antagonist of thrombin. It inhibits majority of the actions of thrombin, and it is prescribed to patients that have atrial fibrillation and to also prevent venous thromboembolism or VTE. As for warfarin, it is a vitamin K antagonist. It prevents the synthesis of factor 2, 7, 9, and 10. It has anticoagulant proteins, ZCNS, which are all vitamin K dependent clotting factors. The advantages of NOACs include that they were developed due to the great number of complications and side effects caused by warfarin. It doesn't interact with food, so patients have a greater quality of life. They do not have to make any dietary changes. Lastly, patients have the same protection against having a stroke as when on warfarin. However, there is a less chance of intracranial bleeding in a patient on NOACs when compared to warfarin. The disadvantages include NOACs being more expensive, it shouldn't be taken by patients with renal failure, and has an increased chance of bleeding in the gastrointestinal tract. Side effects of NOACs versus warfarin. Rivaroxaban and apixaban and dabigatran have common side effects that include anemia, dizziness, nausea, diarrhea. However, with rivaroxaban and apixaban, there are abnormal renal test results. For dabigatran, there are abnormal LFT results, and a P-taxis known as nosebleeds. As for warfarin side effects, they experience severe bleeding, green globs, liver dysfunction, and jaundice. If overdosed with dabigatran, idarucizumab is a successful drug and has been approved by TGA in 2016. However, there are no other antidotes for rivaroxaban and apixaban. Here are the references below that were used in the presentation, and if you encounter any problems with using NOACs, please contact your family doctor.
Wow, thanks doctor for all that information. Could you please write me a prescription for NOACs?
I'll just print off your prescription now. Okay, here you go, Nina.
Oh, thank you so much.
Okay, Nina, have a wonderful day. Enjoy your new medication.